Hi, I'm Dr. Jonathan Davids. I'm the Corporate Medical Director at DriverCheck. DriverCheck's purpose is to build a healthier and safer world. This purpose has never been more obvious or pressing than it is right now. With the recent COVID-19 pandemic, there have been a lot of questions surrounding what people can do to keep themselves and their loved ones safe. Today I'm going to share some tips and information to help answer some of those questions so you and your loved ones can stay safe and healthy. Wash your hands frequently and carefully. The most effective way to prevent the spread of COVID-19 is to wash your hands frequently with soap and water. You should wash your hands for at least 20 seconds, and especially after you've been in a public space and have touched things like doorknobs or handles, other surfaces, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. The exact time COVID-19 can survive on surfaces is not clear, but can range from hours to days depending on the surface and environmental conditions. You can get the virus on your hands if you touch a contaminated surface like a doorknob, gas pump handle, or even your cell phone if these have been contaminated with respiratory droplets from an infected person. If you contaminate your hands and then touch your mouth, nose, or eyes, you can easily transmit this virus to yourself and become infected. Cover your mouth and nose when you cough or sneeze. Cough or sneeze into your sleeve at the bend in your elbow, or use a tissue. Always throw used tissues in the trash right away. COVID-19 is spread from person to person mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can travel through the air for a distance of about 1 meter, 3 feet, and land in the mouths or noses of people standing nearby or on surfaces, contaminating them. Covering your mouth and nose prevents spreading the virus this way. Remember to immediately wash your hands with soap and water or use an alcohol-based hand sanitizer. Take social distancing seriously. Social distancing, also known as physical distancing, minimizes contact with people in order to prevent you and others from being exposed to and becoming infected with COVID-19. It may mean that you have to work from home or work remotely. Go about your day, but avoid crowded places and increase your personal space from others wherever possible. Clean and disinfect. It is important to clean and disinfect frequently touched surfaces in your home or workplace daily. Isolate if you have symptoms and are sick. If you develop symptoms of a fever, cough, difficulty breathing, or to a lesser degree muscle pains, fatigue, headache, sore throat, or a runny nose, stay at home. If your symptoms are mild, manage them with medications such as acetaminophen and stay home until you recover. If you need urgent medical care, call 911. For more information, visit our website. Thank you for helping to prevent the spread of COVID-19. Let's work together to keep ourselves, our loved ones, and our community safe from COVID-19.